think it plays a very important role when it comes to viral replication, initial infection of an individual, and also transmission of the viruses to other individuals. And this is because we measured high viral loads of SARS-CoV-2, but also of other respiratory viruses in the saliva, and the oral cavity produces infectious droplets and aerosols. I think we can distinguish between pharmacological measures and non-pharmacological measures. When it comes to pharmacological measures, I think the new vaccines adapted to present variants will be very important. These vaccines should be more effective against the BA.5 variant of Omicron, for instance. But since new variants will always evolve, it is also important to keep in mind the non-pharmacological measures like social distancing, if necessary, triages, or facial masks and mouth rinses. I think as a virologist, I can say that we learned how quickly viruses can evolve over time. So we saw how quickly SARS-CoV-2 developed several variants that were quite different, also from a clinical standpoint, from the severity of the disease. So I think it's important to keep the measures such that they can be quickly changed and adapted to the variants, but also to have measures in place that are independent of the variants. So like facial masks will work for every variant, and also disinfectant mouth rinses will basically work for all variants independently of mutations. So whatever mutations may come up that can evade from the immune system or can confer resistance to antiviral drugs, these barrier measures will always work. What I have to say also as a virologist is that mouth rinses should be really also tested for viruses specifically. Traditionally, they have been more tested for bacteria, like chlorhexidine, but to specifically characterize their activity against viruses is